Hello again. Now, while many of us may not like exercising and eating healthy, some fitness and health experts have advised that it is also has a positive impact on our sleeping patterns. Those things do. Well, let's discuss more about sleep and sleep disorders now with JD Ace. He's a sleep and fatigue consultant. I'm learning all kinds of different careers and jobs today. JD, thanks so much. So, a sleep and fatigue consultant, where do you fit into the treatment or the diagnosis and treatment?
We treat people with several types of sleep illnesses, like Dr. Allison and Nirana has mentioned, and we coach the patient through the process of getting healed, and we train them how to sleep better. Using the resources that we have today, the technology like CPAP and cognitive behavior therapy for insomnia, and we use mainly for insomnia, then we use cognitive behavior therapy for insomnia to coach and consult patients to beat insomnia.
Okay, tell us a little bit more. Cognitive behavior therapy, yeah. How does that work?
It is currently the golden standard in treating insomnia in the worldwide.
Yeah, what do you actually do?
It is consisting of we use the two main drives of the body, the circadian rhythm and the homeostatic sleep drive, to consolidate it and bring it together and use treatment sessions, consultation sessions, to coach people how to get rid of certain sleep behaviors and daytime behaviors to improve sleep during the night. It's quite successful, and it's currently the golden standard.
Does it involve machines? Does it involve music? Does it involve floating in a tank? How does it actually work?
It consists of consultation sessions. It is not necessarily technology, although we use technology and data to make certain choices. CBTI, or cognitive behavior therapy for insomnia, is quite, it's a standard process that we follow, but it's also very individualized. It's suited to the specific patient and his own specific challenges.
And depending on that disorder, there's a particular treatment.
We diagnose, we see it's very important to diagnose insomnia and not advanced sleep phase disorder or delayed sleep. Insomnia has to be diagnosed very specifically, and then we can treat it.
Just describe for me the state some of your patients come to you in. What are they going through? Yeah.
Well, it's as Narina mentioned, there's a big boom in coronasomnia. Insomniac patients are usually the patients who are suffer from what we call a comorbidity, like post-traumatic stress disorder or anxiety or perpetuating factors that influence their insomnia so that it is chronic. Many patients have sleep-breathing disorders. Down syndrome is underdiagnosed. Breathing issues in Down syndrome babies are underdiagnosed at the moment, and that needs to be treated. And we coach patients in with surgery or with PAP, which is not very successful, but for babies now.
Yes. So do you work with babies as well? What's your youngest patient?
I work with Down syndrome babies and autistic children, and then I can refer them to specialists that work with me in the industry.
And these treatments, are they just a couple of weeks at a time? Is it, and then they go on to apply what you've, or some ongoing treatments? So they have to keep coming to you.
I presume you talk about insomnia. The CBT is basically a 5 or 6 week process. And then after it is done, we measure it. We measure the progress on graphs, and we look for specific clinical progress, and we focus on that. And after the sessions, that's the good thing about cognitive behavior therapy, it's a long-term process. And patients can, most of the time, get off their sleeping medication.
Well, JD, a lot of people might be thinking, I'm in my 60s already, this could be, is it worth me going to now be trained? I've lived with this, but is it too late? Is it ever too late to train yourself to sleep properly?
No, it's never too late. It is, what we can do, is identify the cause of the insomnia. That's also very important. Then we work on the cause, and we also then work with cognitive behavior therapy for insomnia to treat the cause and to learn better sleep behavior. It may be a bit more challenging, but I've got patients from 68, 70, 80 years old. My oldest patient was 82.
Wow.
So it's very successful.
And what's the changes you've seen in them afterwards? What's been the feedback? Are they living different lives after that, I would imagine?
Yes, we usually see results within about 2 to 3 weeks. We use certain measurable statistics like sleep latency onset, wake after sleep onset, and very importantly, we use sleep diary data to make certain choices. So the patient has to complete a diary, a sleep diary, and we make those choices.
What's a sleep diary?
It's basically a diary that it's electronic as well.
Okay.
And the patient tells us on this diary what time he's going to bed, what time he tried to fall asleep, how many times he was awake, you know, what time he woke up, how he felt, and what medications did he drink.
Do dreams play a big part in this?
If it's a nightmare and post-traumatic stress disorder, it plays a big part.
Okay.
But I'm not a dream specialist, and I don't lay out dreams and stuff like that. If a patient dreams, it's okay. Where dream can play a role is if a patient has REM rebound sleep.
Okay.
So that's another issue.
Okay, so lots of help. You don't have to live with sleep disorders.
No,
you can learn to manage them and beat them to an extent. JD, how can people find you? Where do they find you?
Okay, they can phone me on my mobile number 082 560 6872.
Yeah.
I'm on Facebook, Arkel, ARKELSHC.
Okay.
And .com is my website address, and then they can also leave a message there or send or email me on info@arkelshc.com.
Fantastic. JD Ace, thank you so much for that. And let's just give you the other contact details as well for our other experts if you are battling with sleep. Dr. Alison Bentley was bentleypractice@gmail.com. That's bentleypractice@gmail.com. And then Neera, N-E-E-R-A, at santonsleeplab.co.za. That's Neera at santonsleeplab.co.za. I'm giving these out because I know what it's like not to be able to fall asleep, not to have a good night's sleep, and not to be able to function the next day. It happened to me for years, and I'm still getting used to it. Still can't get a good night's sleep. That's it for our health focus for this week. I hope that we've really, really helped you to help yourself.